Margaret Jane Pauley was born October 31st, 1950, in Indianapolis, Indiana. Jane grew up like any other average child, attending church every week with her parents and enjoying her childhood. She went on to attend Indiana University as a political science major. She always aspired to work in television broadcasting, but never imagined this dream would come true. Her perfect world was shattered when she discovered her father's addiction to alcohol. This came as a huge surprise to her because she always saw her father as the ideal gentleman. However, she was fortunately able to get past this shock and support her father in his recovery. Meanwhile, Polly was beginning a family and a career. With her luck and skill, she landed herself a job on NBC's The Today Show and worked her way up to co-hosting position on NBC's Dateline. Little did NBC know that behind closed doors, her life was not entirely what it seemed.
2001 marked a turning point in Polly's life. She began to experience extreme elevations in her mood, ranging from hypomanic to depressive states. Of her experience, Jane Pauley said,
"Feelings came shooting in and out at the speed of bullet trains, along with ideas followed by phone calls that produced action plans.
After seeing multiple doctors, she was wrongly diagnosed and treated for depression. Reasons for her diagnosis of depression came about when she admitted to having suicidal thoughts. A short time after, she was admitted to Payne Whitney Psychiatric Clinic in New York City for a psychiatric evaluation for 3 weeks. Through a thorough evaluation, she was diagnosed with bipolar II disorder. In regards to her diagnosis, Pauley said,
I didn't argue because I knew for too long that I had not been well. I hadn't been well in almost a year."
According to the DSM, Pauley experienced many symptoms that would classify her with bipolar II disorder. Since she had been experiencing hypomania, she would be classified with a bipolar disorder, and doctors were wrong for previously overlooking this. However, her episodes were only hypomanic rather than manic, thus she has bipolar II disorder. Pauley experienced hypomanic episodes along with depressive episodes throughout her illness. These episodes often cause rapid cycling, which is another characteristic of bipolar II disorder. In reference to her episode, she said,
I don't think a stranger would have noticed anything remarkable. I wasn't swinging from the chandelier. It was a spectrum of agitation that could pass before your eyes in a single conversation.
During Polly's manic and mixed episodes, she experienced intense reactions to minor, seemingly insignificant events. The most common and beneficial treatment for patients suffering from bipolar disorder is a combination of lithium and cognitive behavioral therapy, interpersonal and social rhythm therapy, or family-focused therapy. In Polly's case, lithium seemed the most beneficial treatment for her illness. Through our examination of bipolar II disorder, we recommended that Polly stay with her lithium treatment along with the addition of cognitive behavioral therapy. Due to her family and personal dealings with the illness, there seems no need for family therapy.
Fortunately, Polly has been able to turn her hardships into a message of hope. Through her memoir, Skywriting, A Life Out of the Blue, Polly was able to reveal her experience living with bipolar disorder. Despite her diagnosis, she has been very successful and has maintained healthy relationships. Through telling her story, she was able to demonstrate how people can overcome bipolar disorder by seeking treatment and having support from families.